Hello and welcome back to Bump Love. It is no secret that we are living in unprecedented times. It has been about a year since the world was hit by the COVID-19 pandemic, and life as we once knew it all changed. Today we are privileged to have with us on the show Dr. Daniel Tumwine from Children's Clinic Nalia, who is here to share with us just a little bit more information about the disease, about the virus. You're very welcome to the show, Daniel.
Yeah. Thank you. Hi, ladies, and thanks, Pomna.
Yes. So Daniel has been running a series, a knowledge-sharing series on social media, sharing information about COVID-19, and we are blessed to have him here to give us to educate us further or affirm what we already know. So Daniel, there's a heap of information out there about COVID-19. We've been through this for an entire year, but a lot of it is causing anxiety and making people to make a little bit, some mistakes where I feel like going back to square one. So could you guide our audience and give us maybe where are we now? What quick, brief facts can you give us about COVID-19?
Well, okay. Thanks. I think sometimes we forget that COVID-19 is a virus. Surprise, surprise. Because I've never had so many medications and treatments for a virus. So number one, coronavirus or COVID-19 is actually the disease that is caused by a virus called coronavirus. And coronavirus, basically corona just means crown. So if you look at the virus, it looks as if it has a crown or a halo. So it's Latin for crown or halo. And so there are many coronaviruses, hundreds, actually like almost 500 coronaviruses, and they tend to usually infect animals. So we don't usually have a lot of coronaviruses even before. But in the 60s, what happened was they discovered around 4 coronaviruses that actually infect children and adults. So when your child has a flu or has a cough or common cold, chances are, actually 20% chance are, with or without coronavirus, this one, they probably had the coronavirus. So there are many causes of common cold, and coronavirus is amongst them. So coronavirus is basically a virus that causes a respiratory tract infection primarily. And so it causes, as you see, it causes usually flu, cough, but why it is very deadly and different from the other coronaviruses which affect humans is that it causes a very severe pneumonia. And the pneumonia is basically when your lungs get infected and they are filled up with fluid and you can't breathe, and you really start feeling what you call dyspneic. You have difficulty in breathing, shortness in breath, and it can kill you. So that is why you hear people talking about, he went to this hospital and they had to put them on oxygen or on a ventilator. So it really is just a virus that ideally in the vast majority of people causes, first of all, it can cause nothing. It can be asymptomatic. We might be seated here together and all of us have the coronavirus, or the healthier of us will probably just have a small flu. Then the sicker of us can also have a pneumonia. So the older you are, the more severe that pneumonia becomes, and so the more likely you are to die. Unlike other coronaviruses, it doesn't tend to affect children as badly as it does affect the older adults. And therefore you find that actually it affects adults more, but also even us, our age, I'm assuming I'm not above 60, people who have comorbidities. So for example, if you have another disease, so you have diabetes, you have hypertension, you have anything else, so asthma, anything that is a bit chronic, you tend to be doing badly. But 80% of the people who get coronavirus will really not have a severe illness. So why it's so important is, one, it is very infectious. So unlike other viruses, you can be treating your child with a small flu, but you yourself might not necessarily get it. And secondly, I think it's really not infectious. That's why it's a bit deadly. So it's very infectious. That's why very many people tend to get it. And also, your parents and the elderly are really the ones who we need to protect against getting the coronavirus. Where are we? There's a lot of concoctions and myths, as we'll probably discuss a bit later. But from what we have learned is that it mutates very quickly. So actually they said every 5 minutes it's mutating. But doesn't mean that each mutation is very significant, not necessarily. So we've had recently, I think you've had, there's an England mutation, there's South African mutations, which can make them spread more. Not necessarily more deadly, but they just make them spread more. Other mutations can actually make them less infectious. Yeah, and also, of course, right now, the main thing is that we've had isolation, as you've said, yeah, and other things as well. Many of the mutations basically are harmless, and but you can sometimes have mutations in the virus that actually cause it to either be severe or not severe. Another thing that also we are discovering with COVID is that we are seeing more and more people. Okay, some people who are infected, many of them do not get reinfected. So that's a very good thing. However, we are seeing that there are almost 1,000 people who have, we know for a fact, it's documented that they've ever had COVID with this particular virus, with this genome, and then they got reinfected with another virus of a different genome. So you can get reinfected, although it's still very rare. And when you do get infected, some patients get worse the second time round, and then other patients actually it's milder. Okay, and then maybe what we're also discovering now, because is that the immunity with the coronavirus can actually last almost 6 months, because we started studying them 6 months ago. So it could end up being lifelong. So that's a good thing, because I think there are similar coronaviruses which happened. For example, what you call the MERS and the SARS, all those are coronaviruses, and those were like 10 years ago. And we've seen that patients who had those still have the immunity. And maybe the other thing that we're really discovering is what we call long COVID syndrome. Someone has COVID, and actually what happens is, instead of getting better in, say, 21 days maximum, 3-4 months down the road, they're still having what? Symptoms of COVID. And usually it tends to happen in women. It can also happen even if you have it mild. So what I didn't say was that women tend to have it milder than men. And also the symptoms tend to be done usually by a month maximum. But you're finding that more and more patients tend to, particularly the women, or those ones who've had more than one sign. So for example, one of the signs you have, we talked about the cough, the flu, the fever. They actually tend to have a lot of fever. You can actually have a patient with a fever, they think it's malaria, and then what happens? It actually is COVID. So for example, someone might come, one of my friends, even me, I think sometime back, I'm suspecting, but I don't sure because I didn't test. But one time I got a fever, and my blood picture had neutrophils, the neutrophils that fight bacteria, higher. But usually COVID causes lymphocytes to go low. And so when lymphocytes go low in percentages, what happens? Your neutrophils appear higher. So you might have a fever, have high neutrophils, and they think, oh, this one just got a bacterial pharyngitis. And it actually, you're having a what? You're actually having COVID. So it doesn't necessarily mean that you have a respiratory system issue. We're also finding out now that COVID can affect a lot of blood clotting. So you will end up having, say, for example, issues in your heart, issues in your brain. So you might end up having, for example, mini clots in your brain. And so you might end up having stroke. There's a friend of mine walking around and he got a stroke, and only to find that it was what? It was COVID. The other thing is also about just because if you have respiratory symptoms, or you can actually be walking along and you don't have any symptoms, yet your blood oxygen is what? Is very low, what we call happy hypoxic, or where you find that you're walking around, and then you do what? You take the pulse oximeter and it's at 33%. You don't have any issue. Your oxygen is very low and you collapse. So I look more at COVID as a Russian roulette, you know, because you don't know who is going to have which particular type of illness. Okay, I have friends who are healthy and it has hammered them badly. I have elderly people who nothing has happened. So remember, we say many people are symptomatic, so you don't really know. Some of us might be seated here, our blood sugars are through the roof, because we know, and unless you test blood sugars, you will never know that you have diabetes. You might be sitting here, you have hypertension, because blacks tend to be more likely to have hypertension and diabetes generally. Okay, not even what. So that is why you find that actually, even though they say in COVID, 15% will have severe disease. Of those 15%, and then another 5% will have critical disease. That's in China, where they live long, their health is good. Here in Kampala, I'm not saying in Gulu, in Kampala, where we are living on fast foods, I can assure you, many of us, when they get COVID, it will probably be more of us who have more of the severe. But of course, many of us are also young. Uganda population is young, so being young is a good thing in terms of getting COVID. One thing I also want to discuss about COVID that we're seeing, many people are talking about, is the testing, the specific testing. Many people are complaining, but you know what? My patient had all the signs of what? Of COVID. They tested for COVID, but they didn't find COVID. So it's also understanding the science behind testing.
What happens in what would you advise somebody who feels like they have all the known symptoms? What would be like the first aid for a person in such a situation?
Okay.
But what do you do if you think you have the virus?
Then that's what I asked?
Yeah.
So
Many of us go through that.
so there are two types of people who will think they have the virus. Okay, three. The third one is really, I have read in the internet that I have the virus, so now I think I have the virus. You know, those ones of, I think I have a headache, now I have what? Cancer. So that's number three. And then, so number one are usually those ones who have been in what we call a super spreader event. So you've gone to a party, you've gone to a Christmas place, and there's 200 of you, you've gone to a burial, and you're worried that you might have COVID because someone like I was in Soroti 3 days ago burying. The past people behind us were all doing what? Coughing. 400 people at the burial, and you're like, now I'm counting the days, because the symptoms might come after 4 days. So that's one. The people who might suspect they might have. Then there are those ones who start developing cough, fever, flu, and everything like that. Or maybe their person has also gotten COVID. Maybe their workmate or their person at home have gotten COVID, coronavirus, and now they are thinking, what should I do? So the first thing is, don't panic. That's number one. Number two, try in your head to see, are you at risk? So do I have hypertension? Have I been treated for hypertension? Am I a person who has something else, who has other conditions? That's number two. Number three, isolate. Don't call your friends to tell them the story that you think you have COVID. So you need to isolate. The first thing is, if you're a working person, we really want to talk to your HR or somebody at work or wherever you are and say, you know what, I think I might have COVID. This is what I might, I think I might have COVID. So that's isolate, because we all have COVID until proved otherwise, all of us. Yes, so that's number two. Then number three, you really want to get tested. Now, in Uganda, in Kampala, let's say in Kampala first, it's very easy to get tested. Getting tested is a phone call away. And also it depends on how quickly you want your results. So there are there are only, I think, around 13 labs in Uganda allowed to test. But there are like 50 hospitals allowed to test you, or get your sample to send to those 13 labs. All right, so there's probably a hospital near you. Especially I'm talking about, now let me talk about the private hospitals. As long as it's large, okay, we can talk about IHK, Nakasero, Medipower. Now when I start listing names, the other ones will say, why didn't you also mention us? Blah, blah, blah. But the issue is, as long as it's a relatively serious hospital, because we've done training and we've trained many of the private sector to make sure that they're able to take samples, because you need a very serious person who is protected, unless they can also tell you to do it yourself, because we can give you the sample stick and you test yourself either through the nose or through the mouth, and now we have saliva tests that are coming out, so that might be much easier. So that is test from the private sector, the average cost I think is like 350,000. And if you want your test in like 6 hours, so you want to fly out to Mombasa tonight, we can get your results in a few hours. You probably have to pay like 500,000 for the most of the tests. Many people will come and see you. If you don't have that money and you have the symptoms, you can test for free. You can walk to any government hospital, what we call the health center FOS. So there's one, I know you have people stay in Kira sides and Nigeria sides. For example, if you go to Kira, that roundabout, there is a hospital, a government hospital. Many people don't go there. But if you walk in with cough, flu, they will test it for free. Okay. So so the government has said if you have any symptoms of COVID, walk into any hospital, it will be free. If you walk into a government hospital and you don't have the symptoms as we've said, but you know what, I want to test it costs half the price of the private sector. So it will be like 180,000. And so testing can be usually so there are different types of tests, but what we have generally is what we call the PCR test. So the PCR is just a fancy word to say that it has like we're looking for DNA material or what we call RNA material inside that virus, which tells us that it is multiplying. Okay? So that tells you that you actually have the virus, and usually that's a very sensitive test, meaning that if it says you are positive, you really, really are positive. Okay? So that's what we call sensitivity. Then there's what we call specificity. There are other tests where, for example, if you've ever done a malaria test or you've done a Brucella test or a typhoid test and they say you're positive anyway, whether you have the symptoms, those are low specific tests. Those are very low sensitive tests, meaning that if it says you're positive, you don't really have. So those are tests which take a long time. They're very expensive, and that is why it's very difficult. One of the reasons it's very difficult to control coronavirus, because the testing is so hard. If you're testing for, say, HIV or a pregnancy test, what do you usually do? You get what we call rapid tests, which give you test answers within 15 minutes. Yeah. If we had those, and they're quite cheap, if you had those, it would be so easy to control, because all you had to do was, whenever you have those symptoms, you get it at home and you stay home, and everyone who has the symptoms stay home, and then you no longer have. So that's one of the difficulties. Okay. So those tests that we do are very accurate, but there could be times when they give you what we call a false negative.
No way.
So they don't give you a false positive, which is different, but a false negative, meaning that sometimes your patient might have the effects. I have a friend, one of my former workers, who actually died, but had every single symptom of COVID, but they actually tested once. And there are actually studies which show that sometimes when you test once, it might not necessarily be enough. You might need to test like 2 or 3 times. But that's in a very small minority of people, so like almost like 3%. But all the rest of the 97%, if it really tells you you're positive, you're really, really positive. Yeah, so you need to do testing if you suspect that. How do you go to testing? You don't go and get a border guy. You don't enter a taxi or a bus. You ideally want to get private means. Yeah. Okay? And in that private means, the person should be able to, all of you must be able to be wearing masks, and should practice like isolation. When you reach there, you tell them that, you know what, I think I have these symptoms, and they'll be able to isolate you, test you in a few minutes. So, yeah, and then if you're positive, there are 2 things. You can either, well, ideally if you're at a hospital, they will be able to connect you, because isolation is very, very important, and also communication and monitoring as you isolate. Yeah.
So that is you thinking that you have COVID-19. Now you actually have COVID-19. What are you doing while isolating? What are the home care remedies?
Okay.
Like how do you start?
That's assuming that you don't need hospital. So the first thing, so initially you were a suspect that you have COVID. Yes, we suspect a suspect case. Yeah. Okay, we suspect you're pregnant. Like they taught us in medical school, always suspect every woman who comes into your as a patient is pregnant until otherwise. So until you say, yeah, because your medication that you give might affect might affect the fetus. Okay, so always assume every person who comes is pregnant. So just like we assume every person who suspects they have COVID is a suspect case. Okay, now if you're positive, there are two routes. You're either going to be admitted, or and that's really the minority of the people. So either you're 65 or even, but in Kampala I always say it's 50 because I've seen even 50-year-olds. So you're 60, and or you have other issues, other medical issues. You probably need to be in hospital. The rest, they want you to be in what? In isolation at home. If you can't be in isolation at home, they'll probably take you to Nambole or another area where they can help you advise. Why? Because they want to look at different things when they say, okay, you know what, you're Pamela or Rose, and you know what, you are 30-something, I'm assuming, or 20-something. You have no hypertension, you have no diabetes, you just have a mild symptom. So what are we going to do? There should be somebody to come to your home. And when they come to your home, they're looking at different things. One, are you able to self-isolate? For example, are you alone? Okay, some people you got estranged with your family and you don't want anything to do with it. So what is your support structure like? Do you have somebody in the home who is young enough and healthy enough to be able to look after you? Because we want you to separate yourself from in a different room. Two, is there somebody who is also at risk in the home? So maybe you're not alone, you're staying with your grandmother. Okay, so what do we do? Are we removing the grandmother from the home for your sake, or are you the one who's going to go to Nambole or any other hospital or any other place where the government has said, okay, these are people who are not really sick enough to be in hospital, they are self-isolating at home, can't happen, but at least let's put them somewhere. So number three, one of the things we're looking at is, do you have simple things like water, running water? Okay, why? Because you need to be able to make sure that you're cleaning the place and things like that. Okay, are you the sole breadwinner? What happens when you isolate? Okay, you are the ones looking after 300 kids in the home. Then what? Okay, you're going to be fired after 2 days. Okay, or maybe your bedroom is your sitting room. Okay, because I'm assuming some of you have the bedroom, and then you have the bedroom for the shoes, and then you have the bedroom for the toilet. Some of us, everything is in one room. Okay, so the people come and do an evaluation and just see what is the feasibility of you self-isolating. And usually it's done maybe out of Kampala. It's really done by what they call the village health teams, or the what they call, if you're out of Kampala, the district task force. So once you're positive, they will tell the task force, somebody comes and visits you at home. So once you're there, ideally you want to have you want to be isolating in a room, one, that doesn't have a fan, that doesn't have AC, because when you have a fan and AC, you're circulating the air, and that air has your virus. So you want to make sure that first of all, it should be roomy. You'll be able to open windows, anywhere, and ideally you should have your own space. Coronavirus has been found in urine very rarely, and in stool. And however, yes, but it hasn't been found to be infectious in them yet. Okay, so it's always an abundance of caution to make sure that, if as much as you can, use your own washroom. Don't let that person don't use anything that is used by other people, meaning that don't enter the kitchen. Okay, stay in your room as much as possible, and make sure that you isolate and remove patients. Wear a mask, especially if somebody is coming to look after you, because as maybe we'll talk about later, masks actually don't prevent you from getting the virus. It actually prevents you spreading it to other people. So as much as possible, always wear a mask and try to remain as much as 2 meters away from anybody else. The person who's looking after you ideally should be able to clean your room 2 or 3 times a day. When you're entering self-isolation, if you need any other medication, always try and make sure that you have at least 2 weeks supply of any critical medication you have. Or 6 months supply of any chronic. So for example, chronic medication. So for example, if you're HIV positive and it's controlled and you have no issues, what you want to make sure is you have you have any supply for up to 6 months. Always make sure that you have a plan for going away, for being admitted. What does that mean? You must have at least some airtime, have a contact of the person in hospital, because being in isolation doesn't mean that you're on holiday. You need to be monitored, because as we said, there are healthy people who become very ill.
Thank you so much for joining us, Doctor.
Thank you very much.
And to you, our lovely viewers, we love you, and this is just our special COVID edition from us to you. Remember to take care of yourselves and, more importantly, protect your children. Stay safe, and until next time, with love from Bump Love.